I've heard you talk about healthcare being a major expense in retirement and how important it is to plan for it. But how do you plan and budget for something with so many unknown variables?
Well, the good news is once you roll off of major medical insurance, you're most likely going to, not 100%, but 98% of the clients are going to roll onto Medicare at age 65. So we have a class we teach on this. In fact, we just had one this past week.
Miles Morrissey on the show recently.
And it's called the ABCs of Medicare. We explain how it works. So you have to understand there are ways to cover your out-of-pocket by purchasing private insurance to cover what Medicare does not, because Medicare is about an 80-20 split. In other words, you're responsible for 20%, the government pays for 80%. And then there's some procedural things outside of that, and there's things long-term care that are not covered. But you can cover this with insurance. You can cover this with certain types of assets. There are certain riders you can put on insurance policies that you may already have and don't even know you can add a rider for a small fee and get additional coverage. But again, you don't know what you don't know. But it is the second biggest expense the average retiree will face throughout their retirement. In fact, it's about $314,000 in out-of-pocket expenses you're going to face for healthcare. So why not plan for it? Know where the income's going to cover that in your portfolio. Know how, now that's over taking you from age 65 to age 95 that you're going to spend those dollars. So it's over quite a period of time, and it exponentially grows. The older you get, the more expensive this care gets. But we can plan for it, Chip, and we can pick out resources or products or things that may soften the blow. And you can self-insure for this. You can buy insurance to cover part of the load, or you can buy insurance to cover all of these projected expenses.
Well, and it's not just a blind leap. There is data out there that we analyze. I think I saw in Miles Morrissey's presentation recently on Medicare. Isn't it something like $600,000 is what a retiree will spend on healthcare?
A married couple, yes. A married couple, yes. So it's about $317 for a single person.
It's not one size fits all, and we tailor our plans uniquely to each individual and each couple. But there is data that gives you some parameters, so it's not just a blind leap.
Well, not only that,
you can put together a plan.
If you're a client of ours,
study the data.
Many years prior to 65, one of the things we'll advocate for is, if you have the availability, is while you're on major medical from your employer, you may have what's called an HSA available to you, a health savings account. This is the only triple tax-free account in America. You put money in there, you get to write off your income, just like a traditional IRA. It grows tax deferred, so you don't have to pay any taxes on the gains, and then it comes out, as long as you spend on a qualifying expense, 100% tax-free. And when you pay your Medicare Part B and D premiums to the federal government, those are qualifying expenses. So one of the ways we help people reduce that expense burden is cut up the tax bill.
Use tax-free
money to pay that $300,000 versus after-tax money. That can shave 24% of that bill right there by understanding how to tax plan for the medical expenses in retirement. Again, you don't know what you don't know, and that's why you have to have a holistic plan that looks at all the major parts of a retirement, and we call it a SMART plan.